Hello, this is Dr. David Green, CEO of the California Pain Network. The topic today is what are the available knee injections for arthritis? Over 40 million Americans suffer from arthritis. It's the leading cause of disability in the U.S. Interestingly, more women than men suffer from arthritis, to the tune of 20% more. The total cost for arthritis treatment in this country are over $100 billion a year. Between 2000 and 2010, the number of knee replacements in the U.S. doubled. I can tell you that the population did not double between those 10 years. Almost 600,000 knee replacements are performed each year. And by 2030, that number could go up to 3.5 million a year. 35% of those who end up with a knee replacement are between the ages of 50 and 70. It is a quality of life procedure. Nobody died from arthritis. It should only be considered after all conservative treatments have been tried, and this can include nonsteroidal anti-inflammatories, Tylenol, prescription pain medications, topical pain treatments, physical therapy, bracing, and injections. So there are various types of injections. We'll go through them. Cortisone refers to steroid injections. There's hyaluronic acid injections. Then there's regenerative medicine, which includes platelet-rich plasma therapy, bone marrow aspirate, or fat-derived, and amniotic-derived stem cell injections. So since the 1950s, steroid injections have been a mainstay of knee arthritis treatment. They are still the gold standard. They were initially performed for rheumatoid arthritis, and then a few decades later, the results were so good they spanned over into degenerative wear and tear arthritis known as osteoarthritis. They don't cure anything, okay? They're a proverbial Band-Aid. There is some question as to whether or not they do harm cartilage. That was shown in small animals, but when they actually went to larger animals years and years and years ago, they didn't show any damage to cartilage. So it was never proven. Studies show 75% good to excellent pain relief with cortisone, and that may last for months at a time, and then it can be, repeated. So as mentioned, they are the gold standard. Hyaluronic acid injection, that's the motor oil that's in our knees, is hyaluronic acid. In 1997, the FDA approved the first hyaluronic acid preparation that made from rooster combs. And this type of injection is called viscosupplementation. There's numerous trade names now available: Synvisc, Hyalgan, Orthovisc. None of these have shown superiority to one another. One of the largest U.S. studies showed beneficial effects in 80% of patients for over 6 months. So they are beneficial. We don't know exactly how they work. The theory is that they provide lubrication, just like your existing joint fluid, anti-inflammation, and there's conceptually more cartilage being produced as a result of it being introduced into the knee. Platelet-rich plasma therapy has become more and more popular. It involves a simple blood draw from your arm, and that blood then gets spun down in a centrifuge to concentrate the platelets and the growth factors. So if you take 60 cc's from your arm of blood and then you spin it down, you're going to end up with about 10 cc's at the most. That's actually good to inject. And there have been quite a few studies so far, none that have been humongous, but they've shown 70% good to excellent results at 6 months and preservation of cartilage in over 70% at 1 year. This was out of a study from the, the Hospital for Special Surgery. And they did a great study. They looked at platelet-rich plasma. It was only one injection, by the way, and it had very good results. Now, when you move into stem cells, PRP therapy does actually call in the body's stem cells, okay? But to get direct stem cells into the joint, there are a few different ways to do this. One is with bone marrow derived stem cells. Now, these have the potential to alter the course of arthritis and not just to mask pain. So when you start talking about PRP therapy and stem cell injections, it's no longer the proverbial Band-Aid, all right? These are mesenchymal stem cells. They're not embryonic. There's no fetal tissue involved in any of them. Now, when it comes to looking at stem cells for knee cartilage defects, there have not been large clinical studies, but there have been a lot of small studies. So one showed that 6 months after transplantation with the stem cells, the patient's clinical symptoms had improved, and the improvements had been maintained over the follow-up periods between 17 and 27 months, so 2.5 years. The various types of knee injections are all low risk and outpatient. In combination with other treatments, they may help delay or avoid the need for joint replacement, and all these can be repeated every 3 to 6 months as needed. The top non-operative pain management in California is with the California Pain Network. There are multiple affiliated clinics throughout California, including San Diego, Orange County, LA, Inland Empire, all the way up to San Francisco and Sacramento. Over 50 insurances are accepted at the clinics. Over 25 treatment options are provided for pain relief. Overall, there's 90% success rates with the board-certified award-winning doctors. Visit us online today at californiapainnetwork.com and then call us for scheduling at 877-877-8556. I'm Dr. David Green with the California Pain Network. Your pain stops here.